Today I'm talking to Professor John Frey from Wisconsin. John, we're very interested on this side of the pond about what's happening in the US, particularly with the COVID-19 crisis.
What's happened is a couple of things. It's forced practices to start reorganizing, and much of the reorganization is very similar, I think, to what's going on in the UK, where there's a tremendous shift and a very sudden shift away from face-to-face clinic visits to telehealth and phone calls and asking people to not come in for visits that are considered to be unnecessary at this point, or at least not high priority.
When we read about family practice in the US, one of the things I read recently in respect of the coronavirus is that some practices have closed or haven't been sustainable any longer.
Most of medicine in the US, including family practice, is based upon production. It's based upon, putting a bill in for someone you see. And so what happened is when we shifted this radical shift away from actual face-to-face care to telephone care and to dealing with COVID, the volume of visits to practices around the country dropped precipitously. And so many of the practices, the small practices, essentially it's like your restaurant closing or the shop down the road closing, because there was no revenue. And so there's a piece from the Larry Green Center at the University of Colorado that showed that 34% of the practices in the country were financially questioning whether they could last another month. So you have a third of the practices most are closed, at least to new patients and closed to routine care. And the volume of revenue has dropped dramatically. And so we're in the same situation in many cases that, your local restaurants are, or any kind of other small business, because family practice in the States is a small business in many ways. The big systems have really gone into a tailspin because they depend very heavily on elective surgery and things like that to try and bring revenue in to be able to support everyone within the system. And they are dropping 30, 40, 50% of their revenue in a period of a month, to the point where many large systems, including some of the ones that are most famous, are laying people off. And so staff is being laid off, doctors are having their income cut, small practices are closing. And there's a real question of, if this isn't in some way dealt with in the next couple of months, family medicine may be decimated going forward. And that would be an unbelievable tragedy for this country.
Could that mean that, in a sense, despite the public health guidance to shut down the economy, the doctors themselves might be keen for the economy to get opening, particularly just from their own income point of view?
Absolutely. And, there was a statistic I saw recently, for example, that 94% of the dentist's office in the United States are closed. 20% in one of and this is a national study, this is not something local. This is a national sample, that 20% of the family physicians on the study a week and a half ago said that it's very likely they will not reopen after this is over. They will not financially be able to make it. Many years ago when the HMO was around, and people sometimes remember that, they cut back on the number of specialists. But family doctors and generalists were the basis, just like the NHS has a basis of general practice for the whole system. That's what it was back in the HMO days. So we're really in some extraordinary and very worrying situations.